So I'm going to be presenting my project, kind of an idea that I came up for to do my master's thesis that I'm starting to explore in this class. So this is going to be deep learning approaches for complex dynamics capture in computational oncology. There we go. So a little overview. I'm going to go into some quick background and then talk about time series generative adversarial networks, some of the data generation that I've done, preliminary results and how they compare to other data sets that this approach has been used with, and then some future directions that I have for the semester and moving forward. So to start with, cancer secondary to cardiovascular disease is one of the issues that are plaguing the United States and the world in terms of patient mortality. So with this, just a quick little, graphic information here, from 1999 to 2019, we can see that the case count for cancer has continually gone up every year. And with that, while treatments get better and mortality may be slightly less, anything short of essentially an eradication of the disease means that there's still room to improve on development of treatments and helping patients overall. So with that, these modern issues, we try to come up with modern solutions for them. One of the things that we run into, though, with taking this data, observation data from patients, is a lot of the time we're going to have missing tumor measurements. So ideally, a patient is receiving some type of measurement every 21 days. And from that, what a large field has been trying to do now is utilize mechanistic models, so differential equation models, to look into what are the tipping points that are actually occurring, these turning points in disease, such that we can help to inform treatments along the way. Another issue with disparity among data sets, though, is that there's racial inequality. There's also, with the evolving treatments, once you have a model that might work, the minute you change a treatment, that model does not easily generalize. So say if you're treating with immunotherapies and another one comes out, it might give you a starting point, but it doesn't directly generalize over. Same thing with chemotherapies, or even flipping back and forth. And then similarly with that, a lot of these drug trials are performed with older white males. So because of that, treatment guidelines don't automatically generalize to other races. So if you are, say, a 50-year-old Black male with prostate cancer versus a 50-year-old white male with prostate cancer, you are still at a risk receiving the exact same treatment, about 62% more to still die from that disease, even though you both have been given the exact same treatment. So with that, what we're going to kind of look to do here is do some synthetic data generation for interpolation methods, as well as to kind of help inform what we can do. So the real data that we have available can still be utilized to test mechanistic models that are generated from synthetic data. So if we recall, a generic generative adversarial network is essentially playing a zero-sum game between a generator and a discriminator, where the discriminator is trying to tell the difference between synthetic data that's generated versus the original data, and it's predicting real or fake. And then that generator is taking a sampling of noise to generate this synthetic data that should be representative of the original based on learned weights throughout this process. So with this, though, this doesn't exactly directly generalize to time series that may have temporal dynamics or even spatiotemporal dynamics over time. So in 2019, Unit all out of University of California developed a approach called time series GAN, or TEM, which introduces a embedding and a recovery network to the generic scheme. So instead of directly just trying to reproduce this kind of feature space data, so plugging the data directly in and just reproducing that, what we actually do here is embed that data into a latent space and have the generator producing synthetic latent space data. Discriminator is still doing the same task as before, predicting between these real and synthetic labels. But then that ultimate general latent space would be fed back into a recovery network to output the new synthetic data here. So with this, I plan to expand this by adding in one additional component of utilizing the Cindy algorithm, which is sparse identification for nonlinear dynamics, to actually generate out a system of differential equations based on the generated synthetic data that ideally is representative of the temporal dynamics. So ideally, what we have here is two main components. We have the original time scan component, which we can use to produce the synthetic data, and then the Cindy component of the model, in which we can take this synthetic data, find a mechanistic representation of what's happening temporally, and then validate that model with original data. So with this, because of the type of data that we'd be interested in, a lot of the times, like I said, there are issues with just having a frequency that would be needed to do a task like this. So what I chose to do is actually generate a synthetic data set using agent-based modeling. So agent-based modeling is a stochastic approach to modeling phenomena in which we have a agent which occupies a place in a domain of sorts. In this case, it's going to be an on-lattice domain, meaning there is a finite number of spaces within this board. It's not ever expanding. So with that, this agent has a particular set of rules that it's going to go through every single time step within the simulation. In this case, agents only have the ability to reproduce or die. If the probability lands at such they can reproduce, they have an option to reproduce into what's known as their surrounding Moore neighborhood, which is going to be the 8 surrounding spaces highlighted in green here. Obviously, this is dependent on a space being available. So if a agent was to be allowed to reproduce and there were no spaces available, obviously it wouldn't do anything in that step, even though the probability said it should reproduce. So what that looks like through time is if we have we take a simulation here to give a visual of it, and with it, we seed agents in 3 particular locations, and then we look at this transition over time. So there is spatial dynamics that are occurring. And what we have here is a homogeneous population. So there's no treatment involved here. And then likewise, so there's no intrinsic biologic effects. So we're not introducing any type of, say, radiation therapy, immunotherapy, anything like that in the simulation. And there's no otherwise ecological principles in this case. So being that each of these cells hypothetically could live throughout the simulation, they don't have Hayflick's limits. They're not governed by any type of structure. This is just an open space that they're able to reproduce in. And then the probability for reproduction is actually the natural log of 2, which allows the population to double by day. And then anything less than 0.31, you would be removed from the simulation, allowing that space to be opened up. So what we did here is generated quite a few simulations to utilize as the data that we're going to be replicating. And because of all the previous mentions and the homogeneous population, essentially this is just a stochastic variation of a logistic growth. So if we think of the differential equation for that, it would just be v dot equal to RV times 1 minus V over K, where K is the carrying capacity or the size of the board here. The size of the board utilized in this case was 40,000. So there's 40,000 available spaces that these cells can possibly go into. So with that, we now look at some of the preliminary results running this data through the actual TGAN to reproduce synthetic representations of it. So with it, what we actually did was take 5 measurements from the simulation as a whole. We took quadrant counts to get kind of an idea of the spatial dynamic going on, and then likewise took an overall cell count for the region of interest. So if you think about it, there's one major region of interest, which is going to be the entirety of the board, and then sub-regions of interest that we're looking in. So now, because even though this is synthetic data, what we initially started with, the concept was to have a minimal number of data points for each observation, and then try to generate from that. Due to some limitations with not only the original code base, so I had to find an alternative example of this to utilize, which I found with Y Data Synthetic had a nice implementation of TGANs that was user-friendly and ready to go. So with this, what we actually did here is an example of a singular simulation. And so with this singular simulation, we have observations as kind of these inter imaging sessions. So there's 10 sessions in total with 400 total steps within the simulation. And then obviously the 5 particular measurements that have been taken here. And what we see is, while it's not perfect qualitatively, when we reduce this down, do some dimensionality reduction and do Tisney plot of it, what we can see is it's not perfect, but it's clustering roughly where original data would be. So one of the next steps here would be to then start to get actual quantitative measurements from this, and we'll kind of explain that in just a second. But with this, what I wanted to do was, so we have a nice qualitative. Now, what does this look like with maybe some of the previous work that was done? So originally, TimeGANs were validated on a few different types of data sets, including stocks, energy efficiencies, sinusoidal curves. So for that, what we actually did is I was able to sort of replicate their stock data experiment. And what we see is, if we just plot the original data and do a Tisney of that and a PCA, and then we plot the synthetic data that's actually generated by the TGAN implementation, we can see that we get this sort of same kind of qualitative nature that we saw with the ABM results, where we're getting overlay of some of the data, but maybe not all of it. There are exceptions. So it's essentially like having a small perturbation to the data. It's not coming out perfect, but for what we need for mechanistic models, this may actually be quite a useful feature to utilize for these mathematical models. So with that, seeing that we have these similar qualitative factors between the two, that kind of leads that maybe this could be useful. However, one thing that we would run into is that it's a single observation for a patient. And because it's one observation of the disease, what we would like to do is actually have that more generalized to the disease as a whole. And so how we could do that, and what I'm currently exploring now, is, well, these current measures might not be the best approach to do it. And because we desire more population level, what we would do is treat the disease, so say lung cancer, with a particular type of medication and collect patients of those particular observations. From that, we would treat each observation as a different patient. And then from there, rerun the model itself, maybe tuning some of the hyperparameters. There's also some issue with just this, training this locally. One of the mentions from the original paper and other explanations is that the length to train these is substantially long. So these are all trained on 1,000 epochs, and then what is ideal for situations like this for complex would be 10,000 to 50,000, based on some of the literature that I've read. And then following up with this, what I'm looking to do is take some of these synthetic outputs that I'm getting and actually compare the parameter distributions between the two. So we would get an output from Cindy for the original data, an output for the synthetic data, and we can actually compare the growth parameter of both of these synthetic data sets. And ideally, what we would find is that there's not statistical significance between the two if the synthetic is truly representative. And then if that's the case, we're actually able to use the synthetic data to train a mechanistic model. From that mechanistic model, we can then validate it with all real data as opposed to doing any type of splits there. And then likewise, following up with the Tisney, an idea that I had to do a more quantitative measure of what's going on is calculate the centroid for the each of the distributions for the original data and the synthetic data, and then take a Euclidean distance between their two centroids. So obviously, if they are incredibly similar, we would find a very small Euclidean distance between the two. And then likewise, we could do it on a patient individual level by taking cosine similarities between their produced data matrices. And then obviously, if we see something closer to 1, we're finding something that's similar. Closer to -1, we're finding dissimilarity between these two matrices, or these two vectors in that case. But this is what I've kind of approached thus far. Like I said, this is something I'm looking to, really work on as my master's thesis. So this has been a great example of how to kind of get into doing that.